That is completely cutting into your ability to support your family, support yourself, pay the bills, put money aside so that you can retire with dignity, save it for a down payment on a house so that you can build your generational wealth that you can pass on to your children, or be able to commute to your job and have the costs that you have with that, be able to pay your kids' college, be able to pay your kids' trade school, whatever it might be, or your own college, your own trade school, your own home care for your elderly parents, for all the things that we need in our life. That all of a sudden even more difficult to get that benefit that you need, because we're going to double the costs of your healthcare overnight if you have Obamacare, if you have the ACA, if you have the exchange, if you have Medicaid expansion. Again, all these things are the same, one and the same. And so this is going to be cut on November 1st, unless Congress comes together and makes a plan and works together, both sides, to be able to have a plan where there's a compromise between them. The Republicans are refusing to compromise at all. The messaging that's coming out of the Republican Party is that this is, they're tying it to immigrants getting health care. They're tying it to quote unquote illegal immigrants getting health care, and that we're wasting our money on people. That is ridiculous messaging. This is a program that helps all people who are here in such a way that they are documented and are able to pay into this system to be able to get the health care they need. And people who are working. These are people who are contributing members of society that are paying their taxes, that are having jobs, or they're struggling with keeping a full-time job and they have a part-time job, or they have no job at the moment and they're in between it. Like all these people, or they're artists, or they're students, or they're people who don't have an employer that is going to give them healthcare right now. So we need to be fighting right now. You need to be calling your congressperson right now and saying, what do you want me to do when you take away my healthcare?